It's another COVID surge in our area. Allegheny County is reporting more than 1,500 new cases during the last 72 hours, as well as 10 more COVID deaths. Those death reports came from the state registry. And hospitalizations are at their highest point since last winter. But doctors tell KDKA it's different this time around. Amy Wadas is live to explain why and what this means for all of us, too. Amy.
Kim, doctors here at UPMC and other hospitals in our area say they're not just seeing an increase of COVID-19 patients, they're also seeing more patients come into the hospital for things like a heart attack, stroke, even some flu cases.
We've been running near capacity for weeks now.
UPMC's chief medical officer, Dr. Donald Yealy, says hospitals are straining right now. In addition to an increase in COVID patients and people coming to the hospital with other illnesses, they are still dealing with staff shortages.
Many more people seeking care, many who have much more severe forms of illness, and what you've heard about the strain on the healthcare workforce. It has taken longer in some cases to start and complete the care.
Starting care such as longer ER wait times, something he says has gone up over the past few weeks. Another thing doctors say hospitals are dealing with.
There's the throughput, the availability of nursing homes and things like that, because they're also affected with staffing, so the throughput is somewhat limited.
Dr. Don Whiting with Allegheny Health Network says to add to the capacity issue now, transfers from smaller community hospitals.
There are a lot of calls for transfers for different things that can't be managed in the community.
Which doctors say they try to accommodate, but in some cases they can't. Butler Memorial Hospital says it had more COVID cases in its hospital last week than any other time during the pandemic. Butler's spokesperson went on to say the larger hospitals are usually out of beds to transfer patients to.
Community hospitals are elevating the level of care that they give and the people that they keep there, because they also know that it is harder to transfer people.
Now, doctors at both UPMC and AHN say they are able to accommodate patients who need care in the ICU and those who need ventilators. Now, Dr. Whiting with AHN says the need isn't as high in that area as it was at this time last year, as COVID cases aren't as severe. Now, coming up tonight at 6, if you aren't sure if you need to go to the ER and get checked out, we talk to doctors and they explain why that is, again, coming up tonight at 6. Reporting live, Amy Wadas, KDKA News.